back on board a plane. Do that so we can see each other. Excellent. Doctor, tell me, as we head to the summer season, why is it going to be okay to pack the plane?
It is actually very, very safe to be on the plane. And that's because of all the safety measures we've applied. The plane is completely disinfected and clean, all surfaces, every single turn. Also, we know the importance of air quality. So the social distance is a little less important than the air quality and the mask that we are wearing.
We know that the plane has these hospital-grade filters and that the airflow is top to bottom and therefore sucks it out and all of that sort of stuff. But there are still those reports, anecdotal, of people catching it on planes, and the most recent report, which says that transmission is possible on a plane.
On a plane, the risk is very low. In our modeling studies, which we share with the White House and the CDC, depending on the corridor, for example, the US to UK airline corridor, with existing vaccination rates and case rates, that risk of transmission is 1 in a million. 1 case in a million chances.
Doctor, have a seat. Have a seat. Now, we know that the middle seat has been kept empty in many cases because of COVID, and it creates an element of social distancing. But, of course, when other passengers, and we start getting busy in the summer, now surely, my producer, this must be more risky. I mean, he's breathing all over us.
Yes. Richard, that's a great point. I do think with such close proximity, there is proportional increase in risk of exposure and transmission. And distance, although important, is not as important as wearing a mask and air quality. The masks really prevent transmission. So even if our nice guest here was infected and infectious with COVID, if we're all masked, the chances that we'll catch it from him is 0.1%.
Really?
1 out of 1,000.
So people flying this summer do not need to be concerned that somebody is this close unless he takes his mask off, in which case we'll don't even think about it.
Absolutely right. With the current vaccination rates and the current case rate that we have in the United States, and also certain other countries like the UK and Israel, it is very safe to be on a flight next to each other as long as we have the adequate air quality and air exchanges and the masks on board. We're refreshing the air, Richard, every 2 to 5 minutes. So the entire air exchange on a plane is happening 10 to 30 times an hour. The quality of air that's on a plane is actually better than your grocery store.
The myth persists that the aircraft is a petri dish for COVID. How can you change that?
Well, hopefully through science and data and talking to you. It is actually very safe to be on an airplane, and the risk of transmission or contracting COVID is on the order of 1 in a million. I would propose that you have higher risk once you get to your destination, because that's probably the higher risk in travel. It's not in the actual flight.
You'll have to excuse me. I've just been upgraded. Have a nice flight.